Hi everyone, I'm Dr. George Tsangaroulis. So I've been getting a lot of phone calls and messages lately about jaw pain, which makes sense. Many of us are naturally stressed during this time, so what do we do when we're stressed? We clench and grind our teeth. So today I want to simplify and show you what occurs and how it can be alleviated. And Tommy here is going to help me demonstrate. So here's a normal situation with an upper jaw and a lower jaw with teeth and how the teeth come together. These springs that you see represent jaw muscles, which facilitate movement of the lower jaw. Back here, the top part of your lower jaw rests in the bottom part of your skull. We'll say it's like a ball fitting into a socket. These two white lines, along with this yellow piece, represent the alignment of your temporomandibular joint, or what we commonly call the TMJ. The yellow piece is your disc, and your disc should be between the ball and the socket and stays in that position as your jaw moves and this glides down and forward. Notice how when all your teeth touch evenly and simultaneously, the muscles are released and relaxed. The lower ball fits into the upper socket with the two white lines aligned and the yellow disc resting in between. Now, Tommy is stressed, so he's going to be grinding his teeth. And notice what happens to the springs, the muscles. They get activated and they are stretched, like when you're exercising or lifting weights. After a while, the muscles can get into a spasm. Now, let's switch this piece out. Now, let's say when we close, our TMJ is properly aligned back here with the disc in place, which is all great, but notice here, the teeth don't all touch. So now what happens is that there's a nerve pathway where the teeth will send a signal to the brain, which in turn sends a signal to the muscles to activate and to move the lower jaw so that all the teeth can touch, which is also great. But now look what happens at the TMJ. It's no longer aligned. And to take it one step further, let's say the disc is displaced. It's ahead or forward of the ball. And when you open, there's going to be a clicking sound. Okay, so, and that's for the disc to get back into place between the ball and the socket. So that's oftentimes what we hear is we hear a click when we open and close because that's the disc that's jumping back onto between the ball and the socket. So what we're going to do is to address this, we're going to put an orthopedic appliance over the teeth. And now notice what happens. Back teeth get separated, okay, because the back teeth are what program the muscles indirectly through the nerve pathway to the brain to try to get all the teeth to touch together. So we bypass the nerve pathway, we deprogram and relax the muscles, and the disc and the joint are guided into their appropriate physiologic and orthopedic position. So stay tuned for another post, and I can talk to you about what we can do in the interim, now that we're not seeing patients, to help alleviate some of this jaw pain that you may be experiencing. Okay? Hope that helps. Be safe.